Today's story begins with a woman who went to the hospital for an examination and came out with a surgery she never agreed to have. The year was 1908. Mary Schloendorff was suffering from stomach problems and checked into a New York hospital. During her examination, doctors discovered what they believed was a tumor. They recommended surgery to remove it. But Schloendorff had already made up her mind. She agreed to be examined. She agreed to be tested. But she clearly told the doctors that she did not want surgery. The doctors disagreed. They believed removing the tumor was the best course of action. So while Schloendorff was under anesthesia, they performed the operation anyway and removed the growth. When Schloendorff woke up, she learned that the surgery had been done despite her refusal. Welcome to Once Upon a Case, because the law isn't just for lawyers, it's for everyone. Imagine her surprise. She had trusted the hospital with her care, but a major medical procedure had been performed without her permission. To make matters worse, Schloendorff later suffered complications from the surgery. Feeling that her rights had been violated, she sued the hospital. The case eventually reached New York's highest court. The judges had to answer a simple but powerful question. Who gets the final say over what happens to a patient's body, the doctor or the patient? In 1914, the court delivered a decision that would become one of the most important rulings in medical law. Judge Benjamin Cardozo wrote that every adult of sound mind has the right to determine what shall be done with his or her own body. That statement may sound obvious today, but at the time it helped establish a new legal principle. Doctors generally cannot perform medical procedures without a patient's consent. The court ultimately ruled that the hospital itself could not be held liable under certain legal rules that existed at the time. However, the case created a lasting legacy far bigger than the lawsuit's outcome. Today, when doctors ask patients to sign consent forms, explain risks, and discuss treatment options, they are following a principle that traces back to this case. Because of Mary Schloendorff's fight, the law recognized an important idea. Your body belongs to you, and the medical decisions require your permission. And that's the story of Schloendorff versus Society of New York Hospital. Thank you for watching. If you enjoy this story, follow along for more. See you on the next one.